The governor of Georgia called a meeting yesterday to talk about the coronavirus. He says there are now 2 confirmed cases in Georgia, and one of those patients just returned from Italy. Both live in the same home in Fulton County. The results from the coronavirus tests were confirmed last night. Governor Kemp wants to warn you that the most at-risk folks are the elderly and those who have chronic diseases. The symptoms include cough, fever, runny nose, and if you have any of those symptoms, you're urged to contact your local doctor.
As many people worry about the coronavirus spreading, local hospitals are finding ways to tackle the illness. One even came up with an app that could potentially save your life. News Channel 6's Jenna Kelly is live in the newsroom with more on this new tool. Good morning, Jenna.
Good morning, Barkley. So this new app created by some doctors at the Medical College of Georgia is supposed to put a halt to people spreading the virus, even at a doctor's office. If we compare the coronavirus to the flu shot doesn't make you immune to the flu. It just slows down the severity, which makes it safer for others to be around you, except the coronavirus does not have a vaccine yet. So staying in a confined area is a must, so those numbers of those affected don't increase. The doctors at MCG did their research and they found a way. Their study will be published soon.
We're about to publish a study using the phone as an app to have patients that high risk so they don't have to come in. Possibility of us maybe sending the team out to their house, have them do the swabs, and they can keep them until they're self-quarantined until we can say you don't have the disease or you do.
We reached out to MCG, who said the app is on the way. It's still in its very early stages.
In New York City overnight, an ambitious new plan to fight the coronavirus. Every night, workers will scrub hundreds of subway stations and thousands of subway cars and buses, hoping to slow the spread of the virus.
People are going to test positive. Not just 1 or 2 or 3 or 5. There will be many who test positive.
In suburban Seattle overnight, an ambulance took another person from this nursing home, now dealing with an outbreak of the virus. The death toll in Washington state, at least 6, and 4 of those victims lived at that nursing facility. Colleen Mallory's 89-year-old mother, who suffers from dementia, is a resident.
You know, if she gets sick, she's going to be gone.
More than 100 cases of the virus have been confirmed in the U.S. across 13 states. The CDC says nearly 1 million test kits could be available by the end of the week. But a New York doctor calls the lack of testing so far a national scandal, claiming he had to plead with the health department to test people for the virus.
I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case, plead to test people. This is not good.
I think it reflects the frustration on the part of healthcare providers who are trying to test people for this. But some good news, we just learned that even right here in New York City, tests are now being deployed, and so hopefully that will continue rapidly across the country.
Vice President Mike Pence, who's leading the government response, insists the U.S. is prepared for anything. Kenneth Moten, ABC News, New York.
South Carolina Governor Henry McMaster met with representatives from various state agencies to talk about their virus plan. State hospitals are working to make sure they have enough testing kits available with enough manpower to test those kits. Right now, the Palmetto State has the ability to test 100 coronavirus kits a day. No cases of the virus have been confirmed in South Carolina.